I'm Dr. Mark Albers, and welcome to Your Health GPS. Today we're going to talk about rotator cuff tear or injuries and the rotator cuff. That's a very common term. You've heard that probably before. And it's so common because 67% of adults have some type of shoulder pain, and 2/3 of those people have what we call a rotator cuff tear, creating that pain. So let's talk about that. So what is a rotator cuff? The rotator cuff is a series of 4 muscles and 4 tendons that cover the shoulder like a cuff, and that's why it's called a rotator cuff. And so those 4 muscles and tendons are what move the shoulder joint. So that's a big factor in the mobility of that joint, is these 4 muscles and tendons called the rotator cuff. So what's a rotator cuff injury? Well, let's break that down a little bit simpler, first of all, and say that the muscle is attached to the tendon, which attaches to the bone. So my muscle up here attaches to a tendon right here, which then attaches to the bone. So the muscle contracts, that pulls on the tendon, and that's what raises the bone. And that's pretty much with any joint in the body. But that's what we're looking at here. Most of the time, the tear in the rotator cuff occurs in the tendon. So let's talk about that. Here is the tendon here. That's what we're showing here on a smaller scale, is all these fibers that make up the rotator cuff tendon. So those fibers are like the fibers of this rope. Singularly on their own, they're not very strong, but weave these all together, put them together, that makes this rope stronger, gives it strength. Same thing with the tendons of the rotator cuff. All these single fibers make up the whole tendon. So what happens is sometimes these fibers tear due to a fall or an injury, a fall in the ice, a sudden jerking of the shoulder joint can create a tear in these fibers. Not all of them, just some of them. And so what that does is the body's going to try to fix that temporarily, real quickly, with scar tissue. So that's the problem here. Once we get this set up where the scar tissue starts to form, further injuries, even minor injuries, can allow this to tear again, allowing this to grow and build. So what we started out with a small tear can grow into a larger tear, creating more pain and limitation of movement. So it may take years for this pain to show up. You may have injured the shoulder 5-10 years ago, but it's taken that long for all this tearing to occur to create more scar tissue, and that's where the pain starts. So you may have limitation of movement. Maybe you have pain at night. Maybe you have pain lifting that arm. You can't lift it like you used to, even with small things like reaching into a cabinet. So that's where we start to see the effects of this rotator cuff tear, this tear in the tendon. So our goal is to remove this scar tissue and allow the good collagen fiber to be replaced. Well, let's look at the typical medical approach and see if they adhere to that repair like we'd like to see it, where we replace that with the good tendon fiber. Anti-inflammatory medication is very common. So that will help reduce the swelling of this area, but that doesn't remove the pain. It doesn't remove the scar tissue. It only removes the pain. So it's a temporary fix. Same thing with cortisone injections. Who wants painful injections of the shoulder? Again, that does not remove the scar tissue. It just helps remove the inflammation. And there's a lot of controversy about these cortisone injections. They can actually further tear away and eat at this tissue, the good tissue, and there's lawsuits about this. So we don't want cortisone injections because it's a temporary fix. Same thing with physical therapy. Although physical therapy is good, we want that at the end of this process for rehabilitation. We don't want to use that in the beginning because some of these stretching exercises and resistive training exercises can actually create more tearing, and we don't want that. Again, our goal is to remove the scar tissue and allow the good tendon fiber to be restored completely, the normal tendon fiber. That's our goal. So when this doesn't work, our last resort then is surgery. And this is very risky. There's a high failure rate to surgery. So let's talk about what the surgeon's going to do here. They're going to go in there and clean out all this scar tissue, which is good. That's the first step. That's the first thing we want to do. We want to clean out the scar tissue. The problem is they're going to take these tendon fibers and sew them together. And anytime you sew any type of fiber or suture that together, you're going to end up with a scar. If you get a cut, The surgeon's going to sew those two tissues back together, and what are you left with? The scar. That's the problem here. They clear out and clean out the scar tissue, but then they sew it back together, and they create what? A new scar. Just what we started out with this. So we play this cycle again, back and forth. So that is not a long-term fix for a rotator cuff tear. So what can we do? Well, we have what's called a 2-minute shoulder fix. With a 2-minute shoulder fix, in 1 to 2 sessions, you can get 30 to 90% improvement in pain, strength, and mobility in just those 2 sessions with a 2-minute fix. A 2-minute fix. People are so amazed at how much improvement they can get with this 2-minute shoulder fix. So we don't have to go through all this risky stuff. Painful surgery, painful rehab, all the things that give you temporary relief. We could show you how to do this yourself and do it very quickly and see impressive results in just a matter of 1 to 2 sessions doing the 2-minute shoulder fix. Check it out. yourhealthgps.com. Thanks for being here.